Hello, my name is Laura, and I'm going to be your chiropractor today. It's very good to meet you. So, what brings you in today? Okay, so you've had some neck pain, shoulder pain, and some overall back pain. Okay, so if you don't mind, I'm going to ask you a few questions about your pain today as I fill in your personal medical form with us, as this is your first visit with us. Okay. So, are you aware of what caused this pain? Okay. So you're not sure. Okay. And when did the pain begin? Okay. And are you finding that the pain is getting worse? Okay. And have you had this pain before in the past or something similar? Okay. Now, how would you describe the pain? Would you describe it as sharp, dull, sore, tight, aching, spasms, throbbing, numb? Okay. Okay. So I'm going to show you a picture now. This is just for the human body. I'm going to grab you a pencil. Okay. So this is the front of the body. This is the back. Could you direct me to where exactly the pain is? Sure, you can circle it. Okay. Yeah, around there. Okay. So I'm just going to make a write up now of where those quadrants are. Okay. So from the places that you've mentioned today, could you rate the pain on a pain scale for me in those areas? 1 being no pain at all, 10 being worst pain ever. Okay. And that's in your neck? Okay. What about your shoulders? Okay. And your back? Okay. Now, do you find that the pain travels or radiates anywhere? Okay. Does anything aggravate the pain? Yeah. What about sitting, walking, sneezing? Okay. What about coughing? Okay. What about getting up or sitting down? Okay. Now, does anything relieve the pain for you? Heat, ice, exercise, take any medications at all? No? Okay. And have you tried massaging any of the areas yourself, or do you have someone that might be able to help you? Okay. And what does resting do? Have you been resting? Okay. Now, how long do you experience the pain for throughout the day? A little bit? Mornings, nights? Okay. Alright, okay. And have you visited another doctor regarding this complaint? You were referred here? Okay, let me have a look at that. Okay, and this is your current GP? Okay. Okay, so they suspected from their examination that it was a pinched nerve. So I'm going to try my best today to diagnose and confirm what exactly is causing you all this pain, and then we're going to be giving you a treatment suitable for you for it. Okay. So it appears that as you've connected your GP's medical office with our medical office, we also have your medical history. And it appears it's up to date as of about 2 weeks ago. So I don't need to ask you about your medical history or family medical history unless anything of significance has occurred in the last 2 weeks that you're aware of. No? Okay. Alright. So, do you find that the pain is interfering with sleep, work, resting, daily activities? Yeah, okay. Okay, so that is your questionnaire for your medical form filled out. So now I'd like to ask, have you ever visited a chiropractor before? No? Okay. So are you aware of what a chiropractor does specifically? No? Okay. So I will help demonstrate this chart. So we are trained in examining the joints, bones, muscles, tendons of the spine, head, and the extremities. This form of treatment has been around since 1895 for patients with back and neck pain as well as headaches. So this type of treatment today might be suitable for you. Chiropractic treatment focuses on what are called structural imbalances within the spine, and those can affect the functioning of the spinal cord, the nerves, the muscles, the bones and joints of the body. We offer treatments in the form of adjustment, which is more of our more common practice that we use, as well as heat and ice therapy, exercise, massaging, dietary management, ultrasound treatment, diathermy hydrotherapy, and other various methods of pain relief. We tend to focus on manual adjustments of the body instead of jumping straight into things such as medication or surgery. However, we of course do not rule those out as methods of treatment for you should you need them. So we use 3 types of adjustments for the body, including chiropractic manipulation, manual manipulation, and spinal manipulation. Spinal manipulation generally involves applying manual, controlled force into joints that become restricted by tissue injury, with the purpose of restoring the joint's mobility, alleviate pain and tightness, and allows the tissues to heal. All of these treatments have the same aim, and that is to help open up your restricted joint or joints. So for your first visit here today, I will be performing a medical exam of your affected body parts' range of motion, your muscle tone and strength, as well as your neurological integrity. I will then be making a diagnosis based on the information gathered, and then I will be providing you with a follow-up treatment plan. So of course the short-term goal of today's chiropractic treatment is to give you immediate relief. And the long-term goal is to give you a longer, extensive period of relief from your pain so that you can resume your daily activities and feel like yourself again. So as you are unfamiliar with adjustments, I will just briefly explain them. So I'm going to be working and palpating my hands into the affected areas of your body. Now, as I create and make these adjustments to the different parts of your body, you may hear an audible release of gas. We call this joint cavitation. This is caused by the release of oxygen, nitrogen, and carbon dioxide. So you may hear some popping sounds throughout your adjustment and treatment today. All of these are perfectly okay. Okay, so I'm going to begin by putting on a pair of gloves. And I would like if you could just sit nice and comfortably for me. So, before we jump straight into the adjustments, I do need to assess your range of motion, just to be absolutely sure of where exactly that pain is situated. Okay, so if you could, to the best of your ability, follow these basic instructions with me. If you're unsure as to how to perform any of them, let me know and I will demonstrate. Okay, so could you attempt to bend forward and touch your toes? Okay, so next could you please side bend? So hands to your side, both sides, and just dip to the side and that side. Okay, so what was your pain like when you did that? Okay, so could you just hold your hips and bend backwards like this? Okay, and come back. And how was your pain with that? Okay. Now could you please rotate your hips at the waist, turning left and turning right? And how is your pain with that? Okay, so a little stuck there. Okay. Now could you please bring your chin to your chest and up again? And how is your pain with that? Okay. And could you bring your head up? Okay, back down. And how was the pain with that? Okay. Next, could you please bring your ear to your shoulder like this? And the other side. Great. And how is your pain with that? Okay. And now could you please turn and rotate your head like this? Okay, bring it back and the other side. Excellent. And how was the pain with that? Okay. So now, if you could please have your palms like this and try to touch the ceiling. Stretch your arms up. Okay, any pain there? In your shoulder? Okay. And can you try to stretch your arms behind your back, like you're trying to touch the wall? Okay. And now can you cross your arms like this? Okay. And now can you do a full rotation of your arms out like this? Swing them around. Okay. And how's your pain with these exercises? Okay. So you're having a little bit more trouble with one side over the other. Okay. Now can you swing your arms up and drop them down? And how's that? Okay. So now could you reach over your shoulder like this? Okay, good. How's the pain there? Okay. And reach over with your other arm like this. Okay, very good. And how's the pain with that? Okay. So now I'm going to move on to just a couple of orthopedic tests. Put out your arms like this for me. I want you to push forward and I want you to resist against my push. Okay? As I mentioned, you may hear some popping sounds. It's perfectly normal. Okay. And the other arm. Push against me. Good. Good. Do the other arm again. Okay, now could you keep your thumb up and then push with your wrist against me? on the other side. Push against me again. Okay, very good. So, from the information gathered from the exercises you performed, I am seeing that you do have a lot of stiffness and pain in your scapula, as well as your upper shoulders and your neck. You do seem to be exhibiting some signs of pain and problems down in your lower back too. Yeah, just as you described at the beginning of the appointment, as well as on the diagram. Okay, so the adjustments today are like a combination of massaging and physical therapy. They are fairly intensive and quite strenuous, so you might find that you are a little bit tired and exhausted today, but it should bring you a good sense of relief. We're just trying to help break up the tension and build up in between those muscles and as well as around the tissue. Yeah. So try to sit back and relax. I'm going to give you some basic instructions as I adjust. Okay. I'm going to begin with your neck, okay? Okay. So again, you might hear some popping sounds. It's okay. Okay, so just turn your head this way. Okay. And the other way. Okay, so are you noticing any relief so far? Okay. Yeah, it's a strong combination of palpating and physical therapy. It's quite intensive. So I'm just going to work up your back. Okay. You're doing very well so far. So I'm just focusing deeper, stronger palpations of your neck now, as opposed to fast-paced palpations. Just to help the tissues and muscle. Good. Okay. Now could you just turn your head down that way? going to work deep into the muscles of this side. Okay, we'll take a break and we'll do the other side. Okay, the other side again. Are you feeling any relief? Okay. Okay. So now I'm going to be bringing the palpations down your back. I'm going to be focusing down your ribs, down your back, down your ribs, down your back. Good. Okay, and if you could just rotate at the waist this way. Yep, that's great. Good, good, good. Good, good, good. Okay, could you rotate the opposite way now? Good. Okay, and just face forward. Okay, could you bend forward a little bit? Just going to adjust the lower quadrants of your back. Seems to definitely be associated with your pain. Okay, good. Okay, you bend backwards briefly. Okay, I'm just going to work up, up, up your back, okay? And come back straight. We're going to go up again, 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 down again, down again, down again, down again. Are you feeling any sense of relief so far? Okay. Up again, up again, up again. Down, down, and down, and down again. Up again, up again, up again, up again. Down, and down, and down, and down, and down again. Up again, up again, up again. that this can be quite strenuous just because you are working the majority of your muscle groups on your body. Okay, just bend to the side. Okay, just going to focus down your ribs, down your ribs, down and up and down your ribs. And the other side, up and down your ribs, up and down your ribs. Focusing on the intercostals. Okay. Feeling a little bit better? Good. Okay. So now I'm going to bring my hands behind you and I'm going to press and adjust on your scapula, your shoulder blades. So if you could bring yourself forward, down a little bit. Okay. Make a deep adjustment here. Okay, and the other side, deep adjustment there. Good. And on your neck again. Okay, so I'm just going to put my hand on top of your head, bring your head down. And up. Good. And bring your head up slightly. Okay, doing good. Okay, just because you have lots of muscles and tissue in your back, I'm just going to make sure that I have covered all of the necessary adjustments for your back. Okay, so feel free now to sit back, relax. How are you feeling? Yeah, a little bit fatigued. That's perfectly normal. It's just because you worked all of those major muscle groups. But have a little bit of a move around for just a second. How's that pain now on the scale? Much lower? Good. So for your follow-up treatment plan today, I would encourage that you visit us at least 2 times a week for an effective treatment for your pain, or simply whenever you can. At the minimum, I would suggest at least once a week for 4 to 6 weeks, just depending on how that pain is progressing or coming down. After you go home today, I would highly encourage that you drink lots and lots of water. You have been working and stimulating pretty much all of your major muscle groups, so you're going to need to drink lots of water to help yourself recover. Next, I would encourage that you avoid sitting for long periods of time, and if you want to exercise, keep it to some nice gentle exercises. Don't push yourself. And most importantly, rest. Rest is one of the most effective things for our bodies to recover overall. So, for your diagnosis today, I have come to the conclusion that you do have, in fact, a pinched nerve, so I will agree with your GP. However, if you follow this treatment plan, you should be feeling better in no time. So how are you feeling now? That's very good to hear. I'm glad you're feeling better. You may feel a little bit tender and sore for the next 24 hours, but that's perfectly normal. So go home, get some rest, get some relaxation, and I will see you next week. Okay, take care. Goodbye.